Three.
Good morning, everybody. Good morning, KindCare, my lovely team. We are having today, we are delighted to have today Professor Lamberto Ray. I'd like to just remind and highlight that Professor Lamberto Ray, he's only the one licensed in ozone medicine and ozone therapy in Dubai. We are going to find and discover out today why he's only the one doctor licensed by DHA as an ozone therapist, and we are going to discover today as well why only KindCare Medical Center is authorized by DHA, Dubai Health Authority, to provide an ozone treatments. Dr. Umberto, ciao.
Ciao.
Come stai?
Thank you to all. Very fine. Yes, I am ozonated, so very well.
You are ozonated.
Yes.
This is good. How does your travel? How do you enjoy?
Yes, now
Yes.
everything's okay. Yes, enjoy
All right.
travel, but okay, now I am here.
We are happy to have you at the KindCare Medical Center. Thank you for being a lawyer for too many years to KindCare Medical Center. Yeah, we are having too many years relationships and collaborations, and very successful collaborations, because the flow of the patient is increasing. Patients, they are happy. Patients, they are seeing the results. They are seeing the benefit of the ozone treatment, and this is the most important. Quality medical service, and the most important that the patients, they are satisfied and they are seeing the results of the ozone treatment. Dr. Lamberto, our nurses, they are having some questions as well. Our doctors, couple of them, they are here today with us, and they are having some questions regarding the ozone.
Sure.
And they are sometimes they are finding any difficulties, or sometimes there is some issues or questions that they are not able to answer. Already in advance, I informed the team to prepare some questions that you can address to Dr. Lamberto, and Dr. Lamberto is going to answer. So who wants to start? Let's start from the nurse department, from our head nurse, Miss Anita. So tell us, from the nurse department, what issues you are having, what questions or difficulties by providing ozone to the patients.
Good morning, Doctor. Doctor, I want to ask that, is it ideal to give the ozone treatment with the light drip? So even this is an oxidizing factor. The other one is anti-oxidizing, whether we can give together at a time. So
She means about the nutrition, IV nutrition therapy. So she wants your question is how to
yes,
the combination administrations of the ozone intravenosus and nutrition IV nutrition
Yes.
therapy.
Okay, so, first of all, I would like to suggest to all the people here, because the first thing, so I am here in KindCare because KindCare is an excellence.
Thank you.
And this is the reason why I chose this.
Thank you.
So being the only doctor licensed in ozone therapist, so yes, many years ago I was invited, and I chose the best clinic to follow my work in ozone here.
Yeah,
So just to grow by scientific point of view, by clinical point of view, we need to change some idea regarding the name. So ozone therapy for me, now for most of the operators around the world, is not the correct term. The correct term is medical ozone. Okay, we are treating people with medical ozone. Sometimes could be therapy. Therapy does mean like a pharmacological treatment or antibiotics that you can recover the patient completely. In this case, you can integrate with ozone, you can increase the well-being of the body, you can reduce the aging, and this way you can prevent. This is important. So medical ozone, regarding your question, because I want to be...
And here I would like you to highlight it, because too many people, they are confusing
Yes,
ozone with oxygen.
So,
And ozone is O3,
Exactly.
not ozone, not O2. Oxygen is a O2. Medical ozone, it's a O3.
okay, so this is the mistake since the beginning. Why we don't have now real recognition from all the health authorities. The name oxygen ozone therapy, there are two errors, two mistakes in 3 words. Because oxygen is only the carrier. So ozone can be formed starting from oxygen. Like in water, you put aspirin and you drink. It's not water aspirin therapy. So oxygen is only completely possible, because when we inject again the mixture oxygen where ozone it forms, we need oxygen because the amount of ozone is very small, it's by micrograms. So you can imagine you don't have syringe with micrograms, so we can inject together with oxygen, that is the gas from which ozone forms with the generator. Okay, so this is a mistake. Ozone treatment, not therapy, ozone treatment.
Medical ozone.
So for the future, medical ozone. You mean when we inject, the problem with supplementation or integration, this is very confused also in the past, because Professor Bocci, that was the major scientists all over the world told never use antioxidant or supplement together with ozone. But I asked him, please explain why. And now we know that just to avoid this confusion, okay, we can use supplement antioxidant, but after ozone, because ozone is an oxidant, as you saw before. And an oxidant used at a small concentration give back an antioxidant response. Now it's very clear the metabolic pathways, that is the NRF2, that check. This is a sensor inside our body that check for the oxidative stress. So if we give a small oxidative stress, these pathways start to work and protect the body against the damage of higher oxidative stress, starting with the epigenetic mechanism. The DNA express more or reduce expression, and that means that it's the same like an agonist or an antagonist. You can increase or reduce the same effect, starting to come back to homeostasis of our body. So what I want to say, you can use supplementation, but after ozone.
It's a very beneficial to combine ozone with the IV nutrition therapy, but always ozone supposed to be administered first,
Yes.
the beginning, and after that to follow with the IV nutrition therapy. Here I have a question about the glutathione, right? Because the glutathione is getting an every day bigger and bigger popularity. People, they read a lot. People, they are very educated. Some of them they are addicted to the glutathione, and they are asking for the glutathione. So here I need you to bring the lights and to make it very clear how glutathione it should be administered when in the same time, in the same treatment we are having ozone, IV nutrition therapy and glutathione. So what it is, the protocols, and how it should be administered, and what is first, second, and third.
Yes. So glutathione could be second and third, but always after. Some people
After ozone.
After ozone, yes, because some people say because glutathione clean all the body, it could be possible that clean all the ozone effects. It's not true. So ozone is very quick. So when you administer ozone, the game starts immediately. So that's means this protein start to work, and the process go on.
Because of the fast absorption.
Exactly. The molecule of ozone is very high energy molecule. Three atoms, they don't want to stay together for a long time. When they meet our body, biological substance inside our body immediately reacts and start the game. And the game go. And after you can use glutathione every other thing to complete the results. Because could be possible that the adaptive response of ozone is not full. You know that every patient may have a different response. So you can glutathione just to complete the game and clean all
It will only benefit because ozone it's an antioxidant, as the strongest natural antioxidant, and after that we are completing the detoxifications. We are completing with the glutathione, but always the glutathione should be admitted after ozone. Now my questions, just to be completed and to be very clear for my team. Now it's clear that ozone is the first administrating, and after that between IV nutrition therapy and glutathione, which one is first administered?
glutathione.
Glutathione, it's always it's administered before any IV nutrition therapy, or it doesn't matter only nutrition therapy, any others IV medication therapies, it should be administered only after the glutathione. After the glutathione, it's mandatory to flush the vein at least with the 5-10 ml of the normal saline, and only after that to add your IV nutrition therapy, whatever it's a live drip nutrition therapy. Our protocols, amazing protocols that I studied for 2 years, and I made it in amazing protocols. I have already more than 20,000 of the patients go under these IV treatments, IV nutrition therapies, and you know how the patient, they love this nutrition therapy and how they love our protocols, and they are coming often, and they are coming always to have the nutrition therapy with the KindCare Medical Center. Yes, patient, they love the ozone, so because of this they are asking in one treatment to have ozone, to have the glutathione, to have the alpha lipoic acid, and to have the IV nutrition therapy. But always there is no compromise. We cannot compromise on that because the studies has been brought it and has been done the studies. So ozone, it's administrating always first. After the ozone, we are administrating other antioxidant, which it can be glutathione or it can be alpha lipoic acid, whatever. accordingly to the patient's needs and to the individual protocols tailor-made for the patient. So it's after ozone, it is a glutathione or alpha lipoic acid, and only after you flush the vein after the antioxidants, which is glutathione or alpha lipoic acid, you can start drip the IV nutrition therapy or the IV medications.
Okay.
Never ever glutathione is administered after the IV drips.
Yes.
This is a very important. And in our protocols which I have made it, I just have highlighted in the red that never ever, and this is very often mistakes other facilities they are doing because they don't know. Just they catch the trend that the IV nutrition is a very trendy and it's in a high demanding glutathione, but they don't know how to administrate it. Even these days, I find out in some of the facilities they are adding the glutathione and the IV nutrition together with the nutrition. What's used if glutathione as one of the strongest antioxidant, it's destroying all the components which is inside. What's used to do the IV nutrition therapy into what the glutathione to destroy all the components which it's in the mixed all together. Other questions? So here it's clear, team. There is any questions, because this is one of the painful questions that often has been asked and often they are doing mistakes on. So it's clear. Please follow the protocols. Professor Lamberto, he testified, he confirmed it that what is the correct and whatever you are doing, it is a correct protocol. Run the protocols and give the maximum benefits to the patients. Dr. Lamberto, very often the patients, they are asking how much blood they need to be collected when we talk about the medical ozone IV treatment, right? So what is the volume of the blood it should be extracted and ozonated?
Okay, this is also is a very critical point, not critical point, because at the beginning I was
patient they thought as much blood it has been extracted, it's much more beneficial.
No, absolutely no. Must be clear. You need
How
to know
much?
how ozone works. So, when I was invited here, I remember at the beginning, also we work also with the veterinary of the royal family, and we did some measure blood ozonation to Canada, to horses. So in humans, usually the body weight can go from 60 to 120. I don't know. But the other cases are pathologic cases. So there is no huge difference.
It's a body positive now, call it.
Okay.
Over 120, it's called body positive.
So the volume is very important, but most important when the body weight change suddenly enormously, like in horses, 400 kilo, or camel, more. What I want to make that usually at the beginning we thought that the amount of blood was related to the pathology. So if you have an immune system, right, you can use more, or if you want for aging, you can use less. Now the concept is completely changed. It's regularized because there is only one parameter, that is body mass. So if your body mass is 70, I use body mass multiplied 1.5 in all the cases. That is the volume. And the concentration must be adapted to the pathology or to the particular sensitivity of each patient. If you have one patient with hyperthyroidism, you must be cautious because you can increase the frequency.
Let's give a figure. So the patient weight, it's about 70, between 70 to 80 kg.
Yes, 70, 120.
120
120
ml
more or less.
of the
Yes,
blood.
120. If you have 60, is 100. If you are 100 kilo, 150. Depending on but this is normal. Oh, in the medical field, when you use for the baby, we think 1 drop per kilo. This is normal. So, and the ozone is the same. Ozone must give this kind of treatment, this kind of oxidation to a small amount of blood. And this small amount of blood, when come back inside our body, transfer the information to all the 5 liters more or less of our blood. In my experience, I published in 2014, published in European Journal of Pharmacology, the results obtained on 6 students in the medical faculty of Ancona, 3 female, 3 men, measuring the NRF2, that is the sensor of the antioxidant activity inside our cells. So the level of NRF2 was double in the bottle. And after 1 hour, I checked the blood from the other arm and I measured the level of NRF2 was absolutely double the same. It's fantastic.
Amazing.
That means that the information that we have, we can use more, but it's enough. This transfer the information. Look that there is some oxidative stress. So we need to take some action against it and NRF to finish the game.
Doctor,
Go.
I have one patient. The patient, she's a female. She is the patient. She is a female, and she is her weight. It's around 63 kg, and we are not able to collect more than 50 ml. We try very hard. We change the needle. We change the tactic. We change the protocols. We change the lifestyle. But unfortunately, the nurses they're not able to collect more than 50 ml. You know about what I'm talking, right? So, in these cases, the treatment it will be beneficial or not.
So the
Even
treatment
with a smaller quantity of the blood.
I'm sorry, I show you. I tell you, the treatment is always efficacious because the information is spread. Okay, can't be 20, can be 30, but I know this kind of problem. There are people usually with problem with veins, so we can take a lot of blood. But in that
Not only
case,
the veins,
usually-
some of them.
in that case, I complete after giving also rectal insufflation.
Okay.
When the amount of blood is not so high, but because the results will be okay. And we don't have really, now I am trying to do an experimental protocol starting through low doses and low amount of blood, just to see if the level, because important is the level of the activation of NRF2.
And we are activating the blood cells with the ozone, and when,
Yes.
as soon they are in the vein, they are exchanging, they are circulating, so the ozone it will be spread.
Yes, it's spread to all the, just it is enough also one blood cell or two blood cells that when come back, they give the information. So empty, because the problem is that we can have some hemolysis when you give this kind. So must be blood cells functioning now.
So what is the advice here for the patients who it's difficult to extract the blood, or we try very hard, we change the size of the needle, we change the system, but still we are extracting not enough blood. When we say it's not enough blood, less than 50 ml. We are highly advise the patients to combine intravenous medical ozone and rectal as well, just to make sure that the body is consuming and taking enough quantity and concentration of the medical ozone. Doctor, thank you that you highlighted the benefits of the arginine, because me personally, I'm loving arginine. I'm advising arginine to all of my patients. And but arginine as an IV nutrition, as an IV drip, because the fats and the vitamins it's not that effective, and it's evidence proven that all the oral amino acids, vitamins, it's just 10 to 15% absorptions. And this is by World Health Organizations, and this is not my telefields, and this is really evidence-based that medical vitamins that they are taking orally, it's only just 10 to 15% absorptions. I love the arginine. Thank you very much.
I want to say more about this kind of absorption, oral, intramuscular, intravenous. That is very important because many medical doctors forget sometimes that there is a huge difference. When in my classes in the university, I try to explain this fact. If you give one medicine by mouth, any kind of medicine, that all our body is looking for this, you can imagine the way, that is very long way before the stomach, after the liver destroy half of the concentration because its activity is to metabolize, to clean. So if you give IV, and the arginine is very important. In this case, it must be injected before, also, not later, like glutathione.
So
in the day
arginine
before.
it should be
Before.
administered before even ozone, in case if there is an ozone treatment followed by after the arginine. This is very important. And the intravenous administration is 100% absorption.
Absolutely.
If the oral administration is 10 to 15% absorption, intravenous, it's 100% absorption. Doctor, I would like to ask you how ozone can be benefits to the mitochondria and mitochondrial diseases, because these days, unfortunately, some of the evidence-based medicine doctors, they are ignoring because per them protocols they need to, this is a old school and evidence-based protocols, unfortunately, that they are treating the symptoms, not the triggers, and they are not even trying to find the triggers. As well, the biggest mistakes of the Western medicine, the evidence-based medicine, that they are seeing the human body as a separate organs. They are not considering that the human body, it's only one big organ which is all related to each other. So I like to highlight, I want your tips regarding, because these days I have a lot of patients with mitochondrial diseases and mitochondrial dysfunctions. How Ozone can benefit in the mitochondria.
During Brazil, I spoke with the colleagues from a university of Italy, and we decided to start with the protocol in humans, in vivo, during infusion of ozone, medical ozone, to start with this work. Check for different concentration the level of NRF2 that probably is all or none. NRF2 is released or not released. It's not analogic. So increasing the concentration, the release is more, increasing the release is more. But okay, after this step, perhaps there is mitochondria. And we are going to measure two kinds of parameters. We don't know, we are looking for the best parameters and the name now MIT1, MIT2. One is how the activity of mitochondria is related to the activation of ozone.
Doctor, but why mitochondria, they are ignored by evidence-based? Because if there is no mitochondria, there is no life. We cannot perform, because the mitochondrial, it's an energetical power which is giving to all our cells.
Mitochondria is the engine of our body.
That
is the reason why I am in love with ozone, and ozone is help in all our body.
So why the mitochondrial dysfunctions, it's ignored by evidence-based medicine? Because the problem is start from there.
Start from there. It is very difficult. Now we are looking, it is very difficult which parameters we use to evaluate mitochondria. The amount of ATP produced, or the amount of oxidative stress produced. How we can know that mitochondria dysfunction?
So this is
We are doing this now.
Here's the biggest issues, because we cannot diagnose.
It's very difficult, but we know that in some way, because the engine is there inside the mitochondria, our neuron think, and our liver work, and our muscle move, because the mitochondria is inside every cell, and they produce the ATP, the energy, and using oxygen. Oxygen go inside the mitochondria, you know very well. There is this oxidative reduction, oxidation reduction, the production of ATP, and this machine that is perfect. We know there are 4 complexes, and these 4 complexes can be damaged by hereditary. You know that there are some neonatal problems for dysfunction in the mitochondria. Complex 1, complex 2, complex 3, complex 4.
It can be genetic.
And why ozone is so helpful?
It can be genetic as well.
It could be genetic. If it's a strong genetic impact, you can't live more than 60 years.
Can be administered and it will be beneficial, the medical ozone, with the patients that we are suspicious that there is a
Absolutely.
mitochondrial
Absolutely.
disorders.
This is the target.
Combined with the nutrition therapy, right?
Combined, because sometimes
This is the treatment.
No, but not only arginine. So sometimes
course not.
most of the doctors forget biochemistry. So during our study in biochemistry, we studied mitochondria. And we know, for example, that mitochondria, inside the mitochondria, some big people put defenses. Oh, if these people must live on this planet, on the earth, and they have to breathe oxygen, and the oxygen will bring this oxidation, we can give to them the possibility to win, the possibility to defense. And the possibility are the antioxidant enzymes inside mitochondria that are superoxide dismutases, catalases. So, if you remember biochemistry, superoxide dismutases does not work if you don't have selenium, magnesium, or copper.
Q10.
So you can imagine, I give the ozone to 10 people, I have 10 different responses. This is very difficult for science. I am a scientist. And I suppose that during my research in the university, I was very appreciated for this kind of work, because I am in love with science, I am in love with ozone. But why? In the case of adrenaline or some substance like adrenaline, I had to demonstrate the activity of the beta-adrenergic receptors is very simple. because I give something to all you, and the beta-adrenergic receptors respond immediately. But if I treat you with this kind of ozonization, small oxidation, I have 1, 2, perhaps more till arrive the final results. With some dependent integration that we need to know, because we need arginine for nucleoside, we need selenium for mitochondrial activity, and if the concentration of this element inside your body is different, and I am sure that it's different, how can I measure these holistic results? Because what you know is the people feel better. We treat a lot of patients very happy that pay. So does mean that really they have one wonderful results without giving any side effect. Zero.
Please, whenever your study is finished, share with us, because I believe that the mitochondrial disorders, dysfunctions,
Yeah, sure.
is going to get more and more known. And please share with us any studies, any evidence.
We designed the protocol now will be on 100 or 150 patients divided in 4 groups or 5 groups in which we give oxygen, we give ozone 20, ozone 30, ozone 40, and ozone 60 concentration. And after we
Intravenosis or
intravenous only in the clinic.
okay.
And we now the ethics committee that approve. And after we measure in the bottle before we measure NRF2, MIT1, MIT2, and after in the body after 1 hour, and after 24 hours, and after 2 days, because we know that this response is late. No, there are a lot of passages between. It's like the holistic results that we can have with any other lifestyle improvement. No? If we have nutrition improve, your body improve by an holistic way. The liver is better, the brain is better, the circulation is better. And now I am a scientist. What is the parameter that I can measure? It's very difficult for me to start the protocol. In this case, we measure the activity of this. Okay, just it's the first step, because there is not so far a relation to the clinic. Why you have hypertension? Could be possible that there is also mitochondrial dysfunction.
Often we are having the patients who they are in love with the ozone, with the medical ozone, and they are coming when we are admitting them to KindCare Medical Center. They are saying that no, I needed 50 concentrations because I get used somewhere in Mexico, in India, wherever around the world, right? So here we are as a physician feeling the difficulties because we cannot trust, first of all, because they are not providing any medical report or any evidence base that they have done it somewhere else. High concentration. So there is some of them, they think that if the concentration of the medical ozone is higher, it will be more beneficial. So how we need to attend such a patient who they are demanding a high concentration of the ozone?
You need to educate the patient that there are, and in these with the lines, we talk about the generators. Could be more perhaps, but 3 levels of generators, high quality. So if you say, I went in Uruguay. In Uruguay, they use small machinery, they don't have enough money to pay. So if this guy, our patient, go to the level is this one. So if you say me a concentration, I can be sure that is the concentration that you use using a generator. That is important. So
But I'm sure that you are facing these issues as well, right? In Italy, in your clinic, you are facing these issues as well.
yes, I use in my clinic, I have the 3 more expensive generators
So,
of ozone.
What you are doing with the patients who they say that I get used to having
I decide the concentration for you. If you need 50, I give you 50. But before I want to say your performance, because my generator, this generator, they are educated. They come because they respect. If one patient comes for the first time and they want the same here, because this must be an excellence. When the patient come here, they have to realize that is on the best center that know exactly how ozone works and how ozone can be delivered to the patient.
We are only the KindCare, it's only the life center.
The people is not stupid, the people can understand, but you need to explain. If they receive one information from one guy
Or from the Dr. Google.
Dr. Google, yes, I with 6 years. No, you need the right concentration for your body.
So we need, in these cases, we need to follow the protocols. You have the answer. We need to follow our protocols, and we need to follow not the patient's fairy tales. Dr. Khaled.
One important question. Symptoms of over-ozonation. For example, I'm given the child rectal ozone. When I can think about over-ozonation, because sometimes I get a lot of Same thing.
You can have some local disturb, or for example, sometimes you have redness. Redness.
No
Or the frequency of the heart can increase, tachycardia, redness. And also some brucial diseases.
During administrations or after?
At home, yes.
Here is very important.
After.
After administration.
At home, yes.
At home, yes. At home, they come back. Yes, when I arrived at home, I was redness. And also they had rate. Or they don't sleep. The first night, they don't sleep.
So they're over agitated.
I have an idea about this, but you know, when it's holistic results, it's very difficult. But because, and it is well known that many sportsmen, also football players, and that use ozone. And the medical ozone increase the delivery of oxygen to tissue. So that's another thing. Forget the idea that we can tell to the patient, we oxygenated your body. The oxygenation of our blood is done by the lung. Finish. But what it is important in the case of medical ozone, when you give medical ozone, the amount of oxygen released to the tissues is higher. So if you have a saturation of 90%, and the blood arrives to the hand, to the liver, to the neuron, to the hand, and come back with 40. That means that releases 50% of the oxygen by hemoglobin. When you treat the patients with ozone, with medical ozone, the blood arrives 90 and come back to 80. Release 70. More. We can open a big scenario, a lot of scenarios. You can think about, okay, now the energy, why they don't sleep? Because when more oxygen in your tissues, you need to move.
Energy
If you give this in the morning and you tell the patient, please go to the gym in the afternoon and spread your energy, and they sleep. Or for example, if you have this already in the afternoon, it is all this energy remain in your body, and probably you don't sleep during the night.
Doctor, my case, after ozone, I'm sleeping like a baby, living nice, amazing dreams.